Our goal at Pinnacle is to provide outstanding quality emergency care, but also to give patients the encounter that they anticipate.
It's not just about numbers, it's not just about checking off boxes, but it's also about the patient recognizing that they are getting the care, the best care that they can get.
They should have all of their concerns addressed. We are very into making sure that the patient experience is a positive one.
Patients can expect that the staff cares.
What impresses them is that they also get the attention to detail and the customer service focus that you don't see at other places.
We want to ensure that we are creating a patient experience. We always expect our physicians to deliver the highest quality care possible. Excellence in care is the number one thing. The patient is always number one.
It is a very vibrant place. Things are constantly changing. However, it's a change with an eye to improvement and an eye to staying ahead of all the changes in healthcare today.
I do think it's a great place to work. I enjoy the fact that people take care of one another. Very much a team environment in the emergency department. We all are aligned and working on the same goals to meet patient outcomes.
We are getting very clear messaging from our administration, from the CEO all the way down. We are getting some clear direction of where we want to be, clear direction of how we're going to get there, clear goals as to what it is that we need to achieve in order to be the leader in healthcare delivery.
Fortunately, we have an executive director of emergency services that has a role directly in the administration. We have the ear of administration, and they work very closely with us in helping us to take care of those patients, meeting our needs, whether it's operationally or with personnel issues.
We're not told what to do. And being part of administration, it's important that we convey that to the doctors, that they have been trained to do the job that they are, and we are not going to dictate how they do their job.
We have great interaction with the administrators, and that results in an opportunity to really make changes that are positive for all the people who work in the emergency department, and that leads to the ability to provide excellent care to our patients.
One of the things that's very unique about our emergency department is that we have multiple levels of service under one roof. When you first come into the emergency department, if you're a walk-in patient, you will be seen by a pivot nurse. The pivot nurse will pivot you literally directly to an emergency room bed or to a primary care office within the emergency department.
We even have a section called Riverview Primary Care. So patients who would benefit from primary care level intervention can get that at a lower cost, sometimes lower wait time, instead of coming into the emergency department. Have that option as well.
More and more admissions are coming through the emergency department, and knowing that we are the front door and that giving people quality service from the moment they walk in is going to help them.
In the Pinnacle Emergency Departments, we have a number of system-based approaches to medical conditions, one of which would be a stroke alert. Pinnacle is currently a certified stroke center of excellence.
If you come in and we identify something in the history and the physical that leads us to believe that this may be a stroke patient, we have a stroke alert team.
We're actually getting the neurologist or the expert to the bedside in a matter of minutes. When we recognize stroke symptoms, we take an in-touch telemedicine robot into the room, and the remote access from the neurologist is within minutes. They're being examined and can have TPA ordered for them.
We're actually one of the few in the area that is using telemedicine in order to leverage that technology and get the specialist in front of the patient as soon as possible. We've actually been able to minimize that time by 22 minutes for our patients that have received stroke care.
We're top in cardiac care. We have a lot of processes in place to improve outcomes for patients.
With a code STEMI, you want to get the patient up to the cath lab as soon as you can. We regularly exceed the national benchmark, and most of the times patients get from door to cath in under 60 minutes. Similar to code STEMIs, we have a code sepsis or sepsis alert.
In this area, we were not immune to the national average of mortality for sepsis patients, which is around 45%.
When a patient is suffering from sepsis, we initiate a similar model which brings the intensivist to the ER, which also puts in place a series of medical interventions and uses high-tech monitoring, again, to make sure that the patient's sepsis is mitigated and that the incidence for end organ damage is also mitigated.
We're actually able to decrease our mortality to 22 to 23%, which is a remarkable feat, especially since the national average is so high.
Anyone who's practiced somewhere where they have had to fight to get a neurologist to assess a patient, where they have had to battle to get a cath lab to open, understands why these things are a big deal. When you can push a button and make a cath lab open up and accept your patient, when you can push a button and a neurology team is there to assess your patient, that's more time that you have to talk to the patient instead of fighting a bureaucratic battle to get your patient where they need to go. Instead of sitting at a desk waiting for a phone to ring, we can be at a bedside letting the family and the patient know what's going on and practicing the high-touch medicine that most of us went into this profession to practice.
I finished medical school in New York City. I grew up in Northern Jersey, New York City area, and I can tell you that back in 2000 I was ready to leave. I was ready to come to an area such as this one. The space, if you would, the serenity or the calmness and the lack of traffic that I was so accustomed to back where I'm from.
We have a lot of local art, theater, and recreational opportunities. We're at the back door of Hershey Park. We have the Appalachian Trail that's within 15 minutes of our hospitals. We have the Susquehanna River, which is renowned for its fishing. We have multiple professional baseball teams.
Aside from being in close proximity to some major cities like Baltimore and Philadelphia, we have a lot of good things right here in central Pennsylvania. Restaurants, things like that, you really don't need to leave the area to have a great time. And it's also a great place to raise your family.
It is a place where the family unit is very well supported, it's encouraged.
Pinnacle affords me the opportunity to work full-time as an emergency medicine physician and still be very involved with my kids' activities at home.
We have an excellent schedule here at PinnacleHealth. We have what we call 5 on, 5 off. That shows many benefits. First, you know what your schedule is out into the future, so it helps with planning, especially if you want to plan, various family activities and outings.
It's a lot of predictability. It avoids some of the physiologic swings you see with other type schedules. You work 5 of the same shift in a row. You work 5-day shifts, then you have 5 days off. If you work 5 night shifts, you have 5 nights to recover before we want to see you back.
We recognize that practicing emergency medicine is a difficult job. We recognize, however, that one of the components of that is making sure that our physicians have balance in their life and that they're able to have the time off that's needed to recharge and reinvigorate so they're ready to come back to work.
We get compensated very well. We have a highly competitive package that is presented to all ranks in the healthcare delivery team in the emergency department.
Benefits are second to none, disability, health insurance, the list goes on of the things that we're given here at Pinnacle.
What are the benefits of working as an employed physician? A lot of hospitals, physicians work as part of contract management groups, and those groups often change. And when they change, you are going to have to find new insurance, you may have a new plan, you may have new everything, or you may have to go with your group in order to leave because the new group may put terms and conditions on you that you just don't want to have a part of. The stability of being part of a hospital employed group of emergency physicians is very difficult to measure. We have the hospital behind us for malpractice insurance. We don't have to worry about the stability of our malpractice carrier.
I don't have any business degree. I don't know too much about business. So it is nice being employed because I don't have to worry about that side. I don't have to worry about benefits. I don't have to worry about the business end of it. I can just practice medicine. Out of the other emergency departments in central Pennsylvania, I think we have the best gig in town.
The key that makes working at PinnacleHealth such an enjoyable job is, first of all, we work in an environment where we're caring for patients. We have all the backup, all the equipment, all the resources that are needed to give excellent medical care.
Emergency medicine is like Forrest Gump. Every day is like the box of chocolates. You don't know if you're going to see someone with a heart attack. You don't know if you're going to see that stroke. You don't know if you're going to see a 1 in 10,000 rare diagnosis. You have no idea what is on the next chart you pick up. And I believe that here we're very well supported in fulfilling that challenge.
I like seeing patients because, especially in emergency medicine, because I have really sick people that come and I have the privilege of utilizing my knowledge and the things that I have learned to change their life.
As an emergency physician, usually the national norm is to move within 5 years of your first job. It is very rare to have an emergency medicine physician be in their first job for 9 years. So that is really a huge selling point that I have not moved since I've been here because the quality of life is so great.
Pinnacle is known to be one of the best places to work in the region. I think I'm a testament to it in the fact that I've honestly never worked anywhere else in my adult career. The support that we feel from administration down and from bottom up, that we're all working towards the same goals, there's no other place that I would rather work.